Hello, welcome to Breast Cancer Awareness. I'm Anne-Marie Lamfair. Joining me today in the studio is Dr. Eric Brown. Dr. Eric Brown has been instrumental developing protocols that provide you with expedited access to testing and other disciplines within the breast specialized team. Whether benign or malignant, safe, expedited care is his cornerstone. Thank you, Dr. Brown, for joining us today.
Thanks, Anne-Marie.
Well, Dr. Brown, let's start with a little background on yourself.
Sure.
What do you do and where do you practice?
I'm a breast surgeon and I practice out of Beaumont Hospital, Troy. I'm the director of the breast center there as well as oncology services for the hospital. And I am involved in all disciplines of cancer from a directorial standpoint, but my practice is 100% breast and I take care of only breast patients.
Oh, wonderful. Well, we're talking with you today for breast cancer awareness. Now, I am a breast cancer survivor. I recently underwent a double mastectomy, and I think that a self-exam and an annual mammogram may have saved my life. So many women don't know when they should start getting mammograms and how often they need to do it. Can you elaborate on the importance of mammograms and when to start? Absolutely.
And that's a great question. And it's actually become more of a controversial question lately. As of now, screening mammograms should begin at age 40 and every year after. If somebody has a family history or other high risk levels of association with just a normal breast exam, they might start mammograms a little bit earlier. We recommend a self-examination, but more just for a woman to get in tune with what's normal for her. We find that if you do self-breast examinations a little too much, it can lead to a lot of anxiety because everything starts to feel like a lump after a while. But as a general rule, as of now, we would recommend screening yearly mammography beginning at age 40.
Wonderful. Well, I hope for the good of everyone undergoing cancer treatment that a cure is near. What are recent trends in cancer treatment?
Every day things change. From the 60s and 70s where everybody was treated with the mastectomy has evolved into now where women have choices. Breast cancer in the past was breast cancer, and it pretty much began and ended there. Now we know there are different subtypes of breast cancer, depending on different factors that you'll find even from a small piece of tissue from a biopsy. Triple negative breast cancer is almost a disease entity in and of itself, and they're all treated a little bit differently. The trends in care are moving more towards tailoring care to individuals. In the past, we would treat women based on how groups of women who were similar to them behaved and responded to treatment. Now we're better able to individualize the care to see what would be the right treatment for you, specifically you, rather than groups of women who are just like you.
A lot of attention has been given this past year to Angelina Jolie and her choice to have a double mastectomy. Can you tell us more about why she made that decision and that she did it and what risk was involved?
Well, there's two reasons for having surgery on the breast in general. One is breast cancer, as we're all aware, and the other is when you are deemed high risk. Angelina Jolie, as a matter of fact, was found to carry a breast cancer gene mutation. So the BRCA or BRCA gene mutation that she had, as was found on a blood test that she had done, showed that she had a risk in the neighborhood of 70 to 80% of developing breast cancer in her life. She chose to address that by doing a double mastectomy. The risks from a surgical perspective of a double mastectomy is really not much different when you're doing it for cancer versus when you're doing it as a preventative measure. Now, certainly women that have a mastectomy with cancer might have chemotherapy that might lower their immune system to the extent where they're more prone to infection. Angelina Jolie did not have that because fortunately for her, she did not have cancer at the time of her surgery.
Right. Well, now 3D mammography is a breakthrough in mammograms. Can you explain to our viewers what 3D mammography is and how it will help depict breast cancer easily and easier in the future?
Sure. 3D mammography, or it's also called tomosynthesis, it's almost like having a CAT scan of the breast. In fact, at Beaumont Hospital, Troy, we are going to be initiating a program of breast tomosynthesis in the very near future. One of the big issues with mammography, and if you will, some of the shortcomings, are for women that have dense breast. Mm-hmm. Think of dense breast tissue as having almost like a complete whiteout of a mammogram. Hard to see through that. Hard to tell if there's something within tissue that on a mammogram just shows white. Right. 3D mammography, like a CAT scan, would almost take little slices of a picture, working its way all the way through the breast. So if something is, quote unquote, hiding in there, you're much better able to depict that with something like a 3D mammogram.
Oh, it's wonderful. Now, what is partial breast radiation, and why would anyone just have partial radiation?
Well, generally when women have a lumpectomy, they get what's called whole breast radiation. And that would be radiation given to the entire breast, and many times a little extra dose given to the spot where the cavity of the lumpectomy is. That's called a boost. Okay. When you look at women that have a recurrence of cancer in their breast, the vast majority who've had a lumpectomy will recur right where the lumpectomy was done. So the thought came about, why don't we just radiate where the lump was removed rather than the whole breast? So there are certain criteria. In other words, it's not for everybody. But under certain conditions, we can indeed radiate just that cavity and about a centimeter of tissue that is peripheral to the cavity. Rather than having 6 weeks of radiation, this is done in 5 days. Mm-hmm. There are 2 treatments a day given via a special catheter into the cavity. After the 5th day, or the 10th treatment, if you will, this catheter can be removed and the radiation is over.
Oh, wonderful. Well, thank you, Dr. Braun, for joining us today. And for more information on breast cancer awareness, what to look for, or anything we talked about here, please go to the website. For Breast Cancer Awareness, I'm Anne Marie Lamphere. Thanks for watching.